And now to the very latest on the coronavirus. As the Delta variant continues to sweep across the nation, the debate over masks and vaccines really continues to be a hot topic all around the country. We're joined live now by family physician Dr. Rob Danoff to talk more about this. Dr. Rob, always good to see you and to have your insight.
Great to see you. Hi.
Yeah, we appreciate you joining us. So it almost seems like, we made a lot of progress and now we're seemingly going backwards. The CDC now recommending that even people who are vaccinated wear masks inside in certain areas. So a lot of people asking, if I've been vaccinated, why do I still have to wear a mask?
And it's a great question, but the reason being is this Delta variant is very, very contagious. In fact, for every one person who has the infection, they can spread it to 6 others. So fortunately, the vaccines are doing a great job of preventing us from getting sick or, having a lot of symptoms. They're really good at that, but you can still get the disease. It might be a small cold, a headache, a sore throat, and you potentially can spread it to others. So if a person who's vaccinated keeps on getting exposed to people without vaccine and with Delta, they can get it. So that's why we want to provide extra protection, not only for the person, but for them to protect others.
And that's what's scary, too, because a lot of children under 12, still not eligible to get the vaccine. And there's been debate over whether students and staff should have to wear their masks when they head back to school. Meanwhile, we've been seeing a lot of reports about an increase in the number of children in hospitals actually sick with the Delta variant. So it's really starting to impact the younger population as well.
Yeah, that's a really good point. So the other reason to get the vaccine is to protect the kids. So the kids 12 and under, it's still not approved for them. We're expecting emergency use approval potentially for 5 to 11-year-olds sometime in October, but it's still a way off. And when all the kids go back to school, it's probably a good idea for everyone to mask up, teachers, students, anyone who works in the school, to decrease the risk of the spread. Look, it's a minor inconvenience to prevent a major problem. So it's a good idea to mask up.
And we can understand that. So there have been a lot of questions also about a booster shot and the potential for eventually needing one. Who do you think will fall into that category, and how soon will they need one?
Important question. They're looking at that a lot. People with immune disease on certain medications to decrease their immune response if they have cancer or certain types of arthritis, autoimmune disease, they may not have as good a response to the COVID vaccines. Those are the first group of people who most likely will get this booster shot. Now, the booster shots, there have been showing some early studies that they really have great added protection against this Delta variant. So stay tuned, but we expect within the next month or so, possibly 2, that boosters will be for certain groups of people who may not have had such a good response because of their current medical conditions.
All right, good to know that. Now, another thing, one of the things that a lot of the people holding out on getting the vaccine, they say they're not doing it because it doesn't have full approval from the FDA. When can we expect that to happen?
We expect that within the next 2 months for sure. They're working as fast as they can, but I think it's really important. And what we're going to see is once there's full approval from the FDA, expect more places, more workplaces, schools, everything to require the vaccine. We have shown through millions and millions of doses that this is a very safe and effective vaccine. The FDA is working really quickly, so hopefully in the next month or 2.
All right, let's hope more people take advantage and get the vaccine so we can help keep everybody safe. Absolutely. Dr. Rob Danoff, always great to see you. Appreciate your time here this morning.
Great to see you. Be safe.
All right, you too. Thanks, Dr.